today what we're going to do is one of the PaCE cases, and the first part of it is to talk about non-negotiable norms.
First day, you get a case, and you're presented with an unknown. So this is a patient that comes in and presents a certain way. It's basically a clinical vignette.
Electronic devices may not be used for personal activities like email or Facebook during the small group.
You first start sort of by laying down ground rules. Are you going to use computers or not? If so, who's going to do it? Who's going to be the scribe? Make notes and use the whiteboard. Who's going to be the leader?
Can the group use a computer to look up definitions or terminology?
It's really the LTC's job to let the students lead and run the rest of that time. We can interject if the time is running long and they maybe need to watch the time better, but they should self-correct in that way also.
We should leave the learning objectives just for like the very end.
As a team leader with this case, my goal really was I tried not to micromanage, but also I wanted to encourage everyone to feel like they're welcome, and I made a lot of eye contact with people.
And then that first day is reading through the case and watching them tease out important things from the history or from the case that's presented.
Goal, to understand the health implications of lead exposure in children.
Line by line, you go through it together. Nobody goes in front, and sort of by paragraph, you start to dissect things.
Mom works in retail. Forcing people to read it one at a time, together, but page by page, just eliminates that like unspoken pressure of watching someone get ahead of you. It just brings the tempo into something that everybody has to abide by.
Up to date on vaccinations.
What the board does is it draws our eyes to the front of the room and we all have the same facts in front of us. Otherwise, everyone has their own biases and they are going to focus on the facts that they think are interesting and ignore everything else.
It's really interesting to watch new medical physicians and new learners tackle information that comes pre-synthesized and try to figure out, okay, what's important in here and what's not important in here.
How does lead exposure affect organ function? And then maybe a bullet underneath that could be liver as well as brain, because we know, and it could be related to oxygenation.
Yeah, liver, brain, anything else.
Well, I think we should have a separate learning objective for blood.
And then at the end of it is when we create these learning objectives based on the information that's been provided. You know, there's a lot of questions. They're questions that you sort of have an idea about, but that'll lead to more questions. And then you create these learning objectives and sort of say, okay, what are we really looking to take away from this case?
Do we have like 7 or 8 really succinct, good learning objectives that we can take home, not like spin our wheels on, come back with good information and talk about them?
Good work, team.
See you Wednesday. We're just going to very briefly review the bare bones outline of the case.
The students come with their answers, essentially, to the learning objectives and prepared to explain and share with the group what they learned while researching the learning objectives.
Ordered some more labs and we found out that he had abnormally high lead levels.
We help set the stage at the very beginning, remind people what the case was, ask if there are any questions, because sometimes there might be some early on that need to be clarified, and then let the leader that was assigned from the time before lead through each learning objective and have the group discuss it.
Kids who are at risk for lead poisoning.
After 10-15 minutes of talking, we started to get into a bit of a groove and start to trust the people in the room, and the quieter ones won't talk unless they are sure it's a safe room. I think over time it got to be kind of exciting. I wanted to know more. I wanted to know what else people had found.
Public health nurses are responsible for educating the families about prevention and nutrition. We always find ways to get there. Even if we hadn't written it down from day one, we get there during day 2 because somebody went off on some tangent when they were doing their preparation, and then somebody else went off on another tangent, but it's connected and it sort of brings you around. It's really cool to see that process develop sort of in front of you with your classmates.
Before 1955, house paint was 50% lead.
While going through the process, it was very enlightening to see how each student found different pieces that maybe another student didn't discover.
What you get is this real like marination of ideas, and you kind of watch it all come together, and usually what you get, I think, are kind of the best of it.
Which is then characterized histologically by chronic interstitial nephritis.
It's fascinating, because that's what we were told would happen. Like they would all get there, and they all did. It's affirming to see that this process works.
It's gratifying, really, I think, because you realize you were doing what you're supposed to be doing. And I think if we believe that, the guidance on these is based on clinical reasoning, like you realize that you're doing that.
If you just listen to the patient, the diagnosis will be obvious. I like to give students positive feedback, find something that individual students and the whole group did well to reinforce what was done right, and then perhaps some suggestions of things that could be done a little differently the next time around.
The feedback was crucial. Being able to talk with a doctor about what we learned and what we could have done differently and the process itself really, in a way, ties the entire experience together.
How did you feel your group process went?
I kind of think of it as like, well, this is what it might be like in the real world, a little bit more than just like trying to memorize a bunch of information. So I found that to be refreshing.